oxygen is found in the top right compartment near where the BVMs are, and it's just going to be in a plastic container with this green and clear piece inside. So what you need for humidified oxygen is this piece. You need sterile water, oxygen tubing, and then whichever mode of oxygen you're going to use, so either non-rebreather, nasal cannula, anything like that. So if you have, it depends on the type of regulator that you have. So if you use this one, which is less common, there's a screw right there, and all you have to do is position the wing nut against it and screw it in. But most of them aren't like that, so we're going to focus on this regulator. This is the one that most of our portable regulators and our main O2 has. So what you're going to do, you start with the O2 tubing. You put it in as you normally would. Connect the other side to the wing nut portion of the humidified oxygen container, and then the non-rebreather or nasal cannula, you just screw it in or push it in there. Once you turn on the oxygen, this one doesn't have any oxygen, so I can't show you guys. Once you turn it on, the container's going to bubble, or the water's going to bubble, and it just sends moisturized oxygen to the patient. So, do you guys know when you would use humidified oxygen? Maybe pediatric patients. More specifically, you're usually with a patient that's complaining of scratchiness in the throat, especially. Second cough. So, especially with fire standbys, you can set this up beforehand because it does take a minute. And this will just make it more comfortable for the patient to receive oxygen. So then, pelvic splint. Let's move these to the side. There are two things you could use. You could either use the actual pelvic splint, which I actually didn't know about until today. We have it in the rider bench, and it just looks like this. I don't think it's in any container, but some of them might be. And can I have a volunteer for the victim? So this is basically a belt. Can you lie down for me? What you're going to do is use it like a belt, so you want to make sure it's the right side. Can you just log roll away from it, please? You want to fold this part up, kind of tuck it under, and then roll back. If it wasn't a rug, it'd be easier to show you a little more. And this Velcro part comes out, roll back. And essentially what you're going to do is, again, just use it like a belt. You slide this part through. Use the orange part for leverage and pull it taut. And then this part here Velcros. So that provides stabilization to the pelvis. You'd use this anytime there's a mechanism of injury that would indicate a pelvic fracture. You don't want to use it if the mechanism of injury comes from the side, so lateral injury. This actually compresses the pelvis more, but any other time you would. If you think it will delay transportation, you don't want to use it. Obviously deal with airway breathing, circulation first, but there can be major bleeding associated with pelvic fractures. So this is definitely a great thing to have. So, any questions? I don't think we have